So that is me. I can assure you, I should stand near the microphone, I'll walk a bit. I can assure you I am wearing pants in that photo. But that was me. I lived on a yacht in the Whitsundays. I loved being outdoors. I loved the summer. I was really active. I was strong. But that has changed. And I've been diagnosed with ALK positive lung cancer for 4 years. Been taking a TKI every day since then. It's a real privilege to be here and talk to you about this because I've been the chairperson of ALK Positive Australia since that time. So for 4 years I've been that person, and I've been speaking with lots of other ALK positive lung cancer patients too. And it's a real privilege to be here with the likes of Ben and Mal. It's a bit of a struggle to follow on from them because I actually have no curves in my presentation. All you're going to have is this photo. And I'm not going to talk about toxicity grades or anything like that because I want to try and share a different experience that comes with ALK positive lung cancer. So what I want to try and do is convey what it's like to have an ALK diagnosis, and then try and also share with you the experience of the side effects as we experience them. So I don't know if you could just move it on to the next slide. It will look exactly the same, but my notes may change, although it's pretty hard for me to read anyway. So the first one I want to do is try and explain what it's like to have ALK. The diagnosis of ALK changes your whole perspective on the world. And the best way I can explain it, it's like suddenly you exist on this parallel road to everybody else around you. Everything changes, but it all stays the same. And we walk, you know, a very different path, but right next to you, where we, externally it looks the same. We do the same things. We go to work, we raise our kids, we have family dinners and everything like that. But there's a subtle thing that happens every 3 months. We have these scans that determine what our future is going to be. And this idea of what progression is going to occur in our bodies and in our brains is never far away from us. And so we're always waiting for this change in this road that we travel, but it's different. But there's the next part, which is trying to live with these side effects that come with taking the TKI. And it's a really hard experience to try and explain to people externally because we look healthy and we're pretty usually fit and experience life normally. But the best way I try and explain it, I used to do a lot of running. I used to do a lot of bike riding as well. And it's like we're always, and I'm sure a lot of people here do it as well, do running and bike riding. And it's like you're always running into a headwind. You know, some days that headwind's a bit stronger and some days it's not quite as strong. You never get a tailwind. From externally, people looking at you, they can't see that wind. But every step that you take is always a bit harder and requires that little bit more effort. You know, from the outside, people just see us getting on with our lives. And that's really deceiving because what they don't see is the extra effort that we've got to do every day just to achieve that level of normal. If you can just move on, thank you. So I think what is usually perceived as the challenge of taking targeted therapy is the severe toxicities. You know, that's what everyone sort of focuses on, you know, the grade 3 and the grade 4s and things like that. I really think the long-term impact of taking a TKI is actually the accumulation of all of these small little things that gradually occur over time, the fatigue, the weight gain, the changes in the way your brain works and thinks, you know, sleep disturbance, and, you know, I've had sun sensitivity and things like that. You know, individually, each one of those things seems manageable, but they accumulate over time. And, you know, it's day after day, month after month, year after year, they never stop. And that's because, unlike many other treatments for other types of lung cancers, you know, chemotherapy cycles and things like that, our treatment never stops. You know, I took a pill this morning and I'm going to take that pill tomorrow, and I'll be taking it again next month, and hopefully I'll be taking it for years to come. And my therapy never stops. There are no drug holidays, you know, for ALK. You'll always be taking a medication and you'll always be suffering the side effects. And, you know, another component that adds to that is, and I talk about this a lot with other patients, is our sense of identity and what all of these side effects do to the way we view ourselves. You know, today I have to avoid the sun. I burn in minutes if I'm out in the sun. I must say I wrote this speech on one TKI. I'm actually on a different TKI now, so it's maybe a bit of a bipolar presentation in that sort of sense. But, you know, I'm 30 kilos heavier today than I was when I was diagnosed. I'm way more fatigued than I used to be. I'm really clumsy. I never used to be as clumsy as I am now. I stumble a lot more, you know. I'm tired every day, but I don't sleep very well at night. All of those sort of things. You know, coming down in the lift, you know, I saw myself in the mirror in the reflection, and it doesn't look like me, the person I remember. But it is still me. It's just a different version of me. So, you know, we're not only adapting as alkies to the diagnosis, we're also really adapting to becoming this different person who the side effects make us as well. If you can move on. So, you know, the side effects also change the way you have to live your lives. Everything I do is planned now, you know. Before I leave the house, it's like, where is the next toilet going to be? You know, my family goes, let's go to the theatre, and I have to plan the stops on the way from our house to the theatre, and how long is the drive going to take, you know. Will there be a place for me to rest? Will I fall asleep in the theatre as soon as it goes dark because my brain stops? Things like that. So it's not the inconvenience of having to do those plannings. It's the fact that you have to make all of these small decisions all the time that constantly remind you that you are travelling on this different road. Like, there is never a moment in your life where you feel like you're normal. You've lost that ability to live without having to consider cancer at every step of the way. Next one, thanks. I've gone a little bit long, so I'll try and wrap it up really quickly. I do want to sort of highlight that, you know, pretty sure my doctor's not here, which is a good thing, you know. Sometimes we're not entirely honest with our doctors about our side effects, because sometimes, you know, it's because we feel like we don't want to sound ungrateful for all of this amazing research that has been done that has given us these extended lives. But sometimes it's because we're frightened that if we tell you of another side effect that we have, that the response we're going to get is, well, it's got to be a dose reduction, or, you know, we need to change treatment. And that's a really scary thing for us. You know, instead of saying to, you know, we're struggling with this side effect or we're struggling with that side effect, when you ask us, you know, we typically say, oh, you know, I'm managing. It's okay, we're doing okay. It's not the same thing. If you could just move on, hopefully I'll quickly get to the end of this. So really, I guess, just move on to the next slide. This one's not needed. I'll try and get it to the end. You know, so often in these presentations you hear, a lot of talk about progression-free survival, and that's really, a very clinical thing, and it's an endpoint for a lot of the research that's done. But I just want to share that for us, that's really important. That's another Christmas, it's another birthday. These things I want to try and help you think that, it's just another Thursday that I get to spend with my family, which is really important. One last slide. The person in the photograph is still here. I'm just walking a different road and experiencing in a different way. I guess the one thing I'd like the clinicians in the room to take away from all of this is, next time you ask that question in the clinic of, how severe is your fatigue, or are you having any side effects? I think the real question you should be asking is, what has this treatment stopped you doing that is important to you? Because that really is going to tell you way more than any sort of toxicity grade ever will. So, thank you.
Wow, John, that was an unbelievable presentation.